We started Concert Health because we understand that a patient's relationship with their primary provider is central to their overall health. Through collaborative care, we bridge the gap between behavioral and physical health, ensuring that patients get fast access to the evidence-based behavioral health treatment they need. It all starts with a warm handoff. Often, doctors ask us, which patients should I send to Concert Health? Our answer is simple. We can help you with any patient who shows signs or symptoms of a behavioral health need. Here are just a few examples of appropriate patients. Any patient who scores above a 9 on the PHQ or GAD they filled out in your office. Any patient who has thoughts of self-harm or harm of others, either identified by suicide screening, their PHQ score, or verbally to you or someone on your team. Any patient with an existing behavioral health condition or past diagnosis who may need additional help managing symptoms. Any patient who is starting or changing medication for their behavioral health, and who would benefit from a team to reinforce medication education, track symptoms, or provide additional counseling. And of course, any patient asking for counseling or psychiatry and who you think would benefit from behavioral health treatment integrated as part of your team. The collaborative care team can help you effectively treat depression, anxiety, suicide risk, bipolar disorder, PTSD, and such symptoms as insomnia or disordered eating that are often symptoms of untreated behavioral health conditions. So, if something feels off, referring a patient to collaborative care is a proactive, low-risk step to refine your diagnoses and put a plan together to help them. Of course, some patients will need treatment beyond the primary care setting. For them, the Concert Health team can support you with help to diagnose, stabilize, and manage them to the appropriate specialty care. Our team can't fix the access gaps we see in the system, but we can support the patient through effective treatments such as behavioral activation steps to make it more likely they engage with the specialty care once it's available. When it's time to make a referral, the process is easy. You will send the order through the EHR, and a scheduler for Concert Health will follow up directly with the patient to arrange an initial session. We know this approach is new for some patients, and providers too. So when you refer a patient, you could say something like, "I'd like to connect you with a member of my care team, a behavioral health counselor from Concert Health, who can check in regularly and support you with some of the things we've discussed today, and keep me up to date on how you're feeling. Would that be all right?" Collaborative care is a covered benefit for nearly all insurances, and often has lower copays than traditional interventions like outpatient psychotherapy or psychiatry visits. If your patient has questions about whether they will have financial responsibility, the Concert Health scheduler can review that with them to make sure they make an informed choice to enter care. It all starts with a referral. And if you have questions or thoughts about ways we could support you better, please reach out to your Concert Health representative or contact us through our website, concerthealth.com. We can improve the health of your patients in concert with you.